Hey there. If you're watching this with one eye open at 3 a.m. while rocking a fussy newborn, you're in the right place. Those first 30 days with a baby? Pure, beautiful, chaos. Remember when you thought, how hard could it be? They just eat, sleep, and poop, right? Yeah, me too. Then reality hit. The non-stop feeding, the mysterious crying sessions, and that new parent panic when they make a weird noise. But I promise you this, not only will you survive this first month, but I'm about to share every tip, hack, and secret that got me through it. This isn't your typical sleep when the baby sleeps advice. These are actual, practical solutions from someone who's been exactly where you are right now. The reality of the first 30 days. The postpartum period is one of the most challenging yet transformative times in a parent's life. No amount of preparation can fully equip you for the overwhelming mix of physical recovery, hormonal changes, emotional highs and lows, and the sheer exhaustion that comes with caring for a newborn. It's a roller coaster, and every new parent, whether birthing or non-birthing, experiences it differently. For birthing parents, your body is healing while your hormones fluctuate wildly. You may find yourself crying over something as small as the wrong snack or feeling completely overwhelmed by a wave of love and exhaustion at the same time. One moment, you feel like you have everything under control. The next, you're doubting whether you can keep going. These emotional swings are entirely normal. Your body has gone through an incredible transformation, and adjusting takes time. Be patient with yourself. Rest when you can, hydrate, and accept help without guilt. For non-birthing parents, the transition can feel just as intense, but in a different way. You're trying to support your partner, adjust to the reality of life with a newborn, and build a bond with a baby who barely registers your presence in the early days. It can be frustrating, especially when you feel unsure of how to help or when your partner seems to have a stronger connection with the baby. But your role is crucial. Small acts, bringing water, handling diaper changes, giving your partner a break, make a huge difference. One of the best ways to survive this period is to lower your expectations. Your house will be messy. You'll eat meals at odd hours, often consisting of whatever is quickest to grab. Showers might become infrequent, and your to-do list may remain untouched for days, and that's okay. Right now, your only real job is to take care of yourself and your baby. Everything else can wait. Then there's what many call the fourth trimester, the first 3 months of your baby's life outside the womb. Your baby has just left the only home they've ever known, where everything was warm, quiet, and consistent. Now, they are in a world full of bright lights, loud sounds, and unfamiliar sensations. This transition is overwhelming, which is why they seek so much contact, comfort, and closeness. If your baby refuses to sleep anywhere but your arms, wakes up the second you put them down, or constantly needs to be held, it's not because they are being difficult or manipulative. It's simply their survival instinct. They feel safest when they are near you, because for thousands of years, that closeness meant protection and warmth. Understanding this won't eliminate the exhaustion, but it may help shift frustration into empathy. This stage is hard. There's no sugarcoating it. Some days will feel never-ending, and sleep deprivation may make everything seem 10 times worse. But you're doing better than you think. Every day, you and your baby are learning together. Every challenge you overcome is proof of your strength. So be kind to yourself. Accept help when it's offered. Lean on your support system. This phase won't last forever, and one day, you'll look back and realize just how far you've come. Survival hacks. Babies cry a lot, and when you're sleep deprived and overwhelmed, it can feel like the crying is never ending. But here's the thing. Babies don't cry just for the sake of it. Crying is their way of communicating, and once you begin to understand their signals, things become much more manageable. Newborns cry for many reasons. The most common include hunger, tiredness, discomfort, overstimulation, or simply the need for closeness. Some cries are easy to decode, like when a baby is hungry. They might smack their lips or suck on their hands before letting out rhythmic, repetitive cries. Tiredness often leads to fussing, eye rubbing, and yawning. Discomfort cries tend to be sharp, intense, and urgent. Learning to differentiate between these cries takes time, but once you do, you'll feel more confident in responding to your baby's needs. One of the most effective ways to calm a crying baby is by using the 5 S's: swaddle, side stomach position, shushing, swinging, and sucking. Swaddling recreates the snug feeling of the womb and helps prevent startle reflexes. Holding your baby in a side or stomach position while awake can be soothing, while white noise or gentle shushing mimics the sounds they heard before birth. Swinging motions, like rocking or bouncing, help them feel secure, and sucking, whether on a pacifier, bottle, or breast, provides comfort. A calming routine can also work wonders. Babies thrive on consistency, so try dim lighting, soft sounds, and gentle rocking before sleep. If fussiness continues, check for basic needs. Are they hungry? Is their diaper wet? Are they too hot or cold? Addressing these first can prevent unnecessary frustration. For babies with colic, who cry for hours despite being fed and changed, extra soothing methods may be needed. Wearing your baby in a sling, giving them a warm bath, or massaging their tummy can help with gas and discomfort. Holding them skin to skin also provides warmth and security, helping to regulate their emotions. It's important to remember that sometimes babies just need to be comforted. They spent months in the womb, constantly held and rocked, and adjusting to the outside world is a big transition. If your baby is crying despite all your efforts, try to stay calm. Your presence alone is reassuring to them. Over time, you'll start to recognize different cries and understand what your baby needs. While the early days can be exhausting, know that you're doing an amazing job. With patience, observation, and a few soothing techniques, you'll soon feel more confident, and your baby will feel more secure. Common challenges and solutions. Now let's tackle the worries keeping you up at night, besides your baby, of course. How to know if your baby is getting enough milk. Count wet diapers. 6 or more wet diapers a day after day, 5 is a good sign. Weight gain is another indicator. Most babies regain their birth weight by 10 to 14 days. For formula-fed babies, expect about 2 to 3 ounces every 3 to 4 hours in the first weeks. For breastfed babies, look for signs of good latch and swallowing. Don't obsess over feeding schedules yet. Feed on demand in these early weeks. It's helping establish milk supply if you're breastfeeding and meeting your baby's needs, regardless of feeding method. Now, the poop situation. Newborn poop changes rapidly in the first week. Days 1 to 2 bring black, tarry meconium. Days 3 to 4 show greenish-brown transitional stools. Day 5 and beyond, you'll see yellow, seedy stools for breastfed babies and more formed, tan-colored for formula-fed. Call your doctor if you see white or clay-colored stools, red blood in the stool, or less than 1 poop every 24 hours in the first month. For spit up, some babies are just happy spitters who spit up frequently but gain weight well and aren't bothered. Watch for forceful vomiting, projectile vomiting, or signs of discomfort. Let's talk about your mental health. Baby blues are common in the first 2 weeks. Tearfulness, mood swings, feeling overwhelmed. But postpartum depression signs include intense sadness or emptiness that doesn't lift, withdrawal from family and friends, thoughts of harming yourself or your baby, overwhelming anxiety or panic attacks, and difficulty bonding with your baby. If you're experiencing these symptoms, please reach out to your healthcare provider right away. Postpartum mood disorders are common and treatable. You don't need to suffer through them. Encouragement and CTA. You are doing an incredible job, even if it doesn't always feel like it. This phase is temporary, and while the days may feel endlessly long, the months will fly by before you know it. In the middle of exhaustion and chaos, when you realize you haven't showered in 3 days, remember, your baby doesn't need a perfect parent. They just need you exactly as you are. Trust yourself. You know your baby better than anyone else. If something feels off, don't ignore that instinct. If you manage to calm your crying baby, take a moment to celebrate it. You're and invisible. Learning just as much as they are. Every day you're both growing. Your baby is discovering the world, and you are discovering how to be their parent. It won't always be easy, but each small victory counts. By the time you get through the first month, you'll look back in awe at how much has changed. The sleepless nights, the trial and error moments, the doubts, they all shape the incredible bond between you and your little one. The things that seem overwhelming now will soon become second nature. And remember, you're not alone in this journey. Every parent has been through the highs and lows of these early days, and support is everything. What has been your biggest challenge so far? Drop a comment below and let's support each other. Parenthood is wild, messy, and unpredictable, but you've got this. If you found this helpful, please hit subscribe for more practical parenting tips without the judgment or the fluff. Next week, we'll be talking about baby sleep patterns and how to start encouraging better sleep habits without sleep training. Until then, you've got this. One diaper, one feeding, one day at a time.